we spoke about in a group of Therapiesalon in Wald, is the Austrian group. I'm doing there an Erasmus internship. Actually, I'm from Slovakia, but still it's about the Austrian group, what we came up with. So the questions were answered in the sphere of our work, our Therapiesalon in Wald, how we do it. So the therapeutic qualities we're trying to imply to make our patients feel that they can trust us is we're trying to show them respect. And one tool of that is the language we speak with them. It's a little bit similar, in my opinion, to the Hungarian group. There's a distinction in German language between this very polite you and this friendly you. It could be understood maybe as usted and tu, or sie und du. I don't know in another language, but there's this distinction, and we use this friendly you. So it's not the typical client-therapist talk, but it's more in the friendly way, the way we treat them. We're trying to treat them, as I said, with respect, show them that we are trying to understand and not feel their feelings, but believe them that what they're experiencing is not so easy, and we're trying to be there for them and support them on their way because they're by us because they want to. Normally it's not because somebody forced them. That can also happen, but normally they're there by their decision, and we want to support them on their way to the life they wish to have. We're trying to be this judgment-free zone where we judge that the behavior they did, for example, they took drugs, they did something maybe illegal, we don't like it, they know that we see it as something wrong, but we don't see them as the wrong ones or them as you're the bad person because you do it. So they know that if they do something, what we don't accept is this behavior of taking drugs or another actions. They know we don't like it, but still we accept them as a person and we still want to be there for them. And they know that they're welcome and they can trust us that we will be there when they need. Part of that is also this accommodation. Sometimes it can happen. There's no free room for the incoming patient who just had relapse, for example. But we're being as flexible as possible, and we have this in underground. We have their mattress when somebody really, really needs to come. We're trying to welcome him in the condition we can offer that time. Part of this trust they can have in us are the rules we have. We're trying to imply them. It's not always easy, but it gives organization in the life of the clients. It's regarding to smoking rules or in general rules in a house that have to be held. With the rules, we're trying to be fair to each other so that they again can trust us that the rules will be same for each, and still trying to be strict with them so that there's not this one is privileged and this other is not, so that they can trust us that it will be fair, they're welcomed, and they feel safe around us. We try to enhance the trust also during the group therapies because it's a good opportunity in the group setting to show them they can trust us. It can happen between the clients, there are conflicts or they're a little bit mean, and there's the therapist to say, okay, that was nice, you cannot say to this person, or that's not right, you cannot treat them this way. And it also helps the person who we stand up for in that situation to trust us more, that they really can rely on us, and when somebody is mocking them a little, that we will not just watch and okay, it's fine when somebody mock you. So it's also a way to accept themselves and see their own worth, and also to trust us and feel that they are in safe space when they come to Therapiesalon. After they leave our residential part, they still can keep in contact with us, or by this semi-residential part where they can come for weekend, once in a week, once in 2 weeks, once in a month for this little refresh, or they're still going to therapy, to our therapists. If they meet the therapist in our place who they like working with, they can continue as a form of aftercare after their residential stay in our facility. The way we're trying to minimize negative consequences of relapse, which can be also not detected or hidden, we try to talk with them the way they know they really can tell us, and the only thing we judge is the action, not the person. So they often feel confident to call us when something wrong happens because they know it's fine to contact us. And still, if they are not confident to talk to us, which doesn't happen often, but if it would, we see it as important to give them information where they can go when they need. Or they find their other therapist they work with, or they know about another organizations they can visit. There are in Austria more than just our facility, and they know it. So if they want to hide it from us, they still have information, what they can do, where they can go when they want to choose another option. But creating this secure, safe space where we don't judge the person, but just the action works pretty well. What we see as a meaningful criteria to stop an aftercare phase, or this semi-residential therapy where they come just time to time, or they go to therapy to our therapist, could be their relapse, and that means when they take drug or do something, they come again for 10 days and be residential in our facility to be stable again, to gather some power, and then go again to this aftercare process. This relapse can mean for different people different thing. For some, it's when they take exact drug. For some, when they take also alcohol. And for some cases, it can be also when they start to break their healthy daily routine they set by us. For example, they start waking up really late, then they are up in the night, and they feel they're going the wrong path. It still could be a reason to come back to be residential and stop an aftercare for a while. If they're doing their aftercare in our facility, and other reasons they were also mentioned before, could be breaking the rules, lack of motivation, when they are dangerous for others, they're bringing drugs to our place, that would be a meaningful reason to stop this phase or exclude them. And there's an important question if there still should be efforts to keep continuity. In most cases, by us, it's yes, that we still try to give them a chance. So it doesn't mean that they break the rule once, that they have to be gone. It's not like this. They're often given another chance and another chance because sometimes they really need it, because it doesn't mean that they don't try when they make mistakes. So often they're welcome, and in some cases when it happens that somebody really break a rule and it's serious, for example, they're blacklisted for, let's say, 2 months or half year, but there still comes time where they are welcome back with no judgment that you're this bad person who did this, but you're the person who tries to get a better life, and we're happy that you want to be on the right path. To be accepted again, they can write motivational letter to show us they really want to come and they really care about the right way, right direction in their life, or they can have this entrance talk with our staff to really show that they're interested and motivated, even what happened in the past, and now they really mean it, that they want to work further. Another reason to not continue could be some really serious psychiatric problems that cannot be treated just by aftercare but need more care in another facility. For example, when somebody is severely psychotic, could be the reason, but often we are trying to help them as much as we can, and they're given another chances as long as we see there the possibility and as long as they want themselves.